Hello, my name is Scott Van Niekerk from Holistic Physical Therapy in Brewster, New York. The purpose of this video is to give you a mini introduction into the art of therapy that we call myofascial release. There are many different forms of myofascial release. Most of them, however, are more similar to massage or soft tissue mobilization and rolfing than what we do here in this office. We have been specialty trained by John Barnes, whose website is myofascialrelease.com, named appropriately. He's the founder of a very special form of treatment of manual therapy or body work, which utilizes a complete spectrum of pressure, from very gentle to very deep and everything in between. Most of the information that I'm about to tell you in the next few minutes, you can read on my website, which is holisticphysicaltherapy.com. That's spelled with a W, as in whole body, versus an H, as in hole in the ground. However, I recognize that some people would prefer to listen and watch instead of read to gain information. So that's why we record this video. The myofascial system in the body is three-dimensional from head to toe, mainly oriented longitudinally. However, there are certain thickened transverse planes such as the thoracic inlet or the respiratory diaphragm, the cranial base, and the pelvic floor. Our treatment techniques engage these areas with varying different styles, such as elongation, like an arm pull, for instance, which we'll show a demonstration of in a few minutes. We also do cranial work, sometimes called craniosacral therapy. That's very gentle manipulation of the head, the cranium, as well as the spinal cord down to the sacrum. That's surrounded by a layer of fascia, very thick fascia, called the dura mater, that can be influenced by fascial restrictions distal in the body, meaning further out to the side. See, with myofascial release, we recognize that the body is interconnected three-dimensionally from head to toe. For instance, if a restriction in the front of our body is pulling us forward in space, we might not feel it here where the restriction is. We might feel it up around the neck, such as with me pulling my shirt. The symptoms that I feel are pressure in the neck. See, the body is pressure sensitive. When there's pressure on the body, it elicits symptoms. These symptoms might be pain, tingling, numbness. There might also be symptoms that you can't feel. The fascia infuses all the organs, surrounds blood vessels, muscles, nerves, etc., down to the cellular level. Therefore, the fascia that encapsulates the heart, which we call the pericardium, or the liver, if that's under pressure, that can be impacting the function of our liver and detoxification, or of our hearts, and we may not be aware of these symptoms right away. Most of the time, people come to our office with complaints of pain, or stiffness, or lethargy, meaning poor energy. And we can help any of these problems. We're not blinded by the diagnoses or even by the symptoms. Every treatment is unique. Every moment is unique. No two treatments are the same. No two patients are the same. So there's no protocols, no recipes, no recipe for success. It's a moment-by-moment dance that's made between the therapist and the patient. That's unique in every session. Sometimes the tissue starts to elongate and open and stretch. We call that unwinding. That's a multidimensional movement that occurs, much like a ball of wool unraveling. It doesn't happen in a straight line. It tends to zigzag back and forth, and the therapist and patient follow that movement without consciously controlling it. As the pressure, which I mentioned, clamps down on the body's tissues, it creates ischemic-like effects, which means cuts blood flow off to organs, muscles, etc. Fascial restrictions that cause these things may be caused by surgeries or trauma. Even birth is a type of trauma. Also, repeated postures over time can cause shortening of the tissue. When there's a surgery, there needs to be a scar for that tissue to heal. A scar we see as the tip of an iceberg with the restrictions lying underneath it, buried beneath the surface of the skin. Think of a tree with a root system underneath that's clamping down on the body structures, putting pressure where there shouldn't be, creating symptomatic complexes that you feel that may be labeled such as fibromyalgia or carpal tunnel syndrome. As these restrictions clamp on the fascia around the vertebrae, they compress vertebrae together, squashing the disc in between and causing disc herniations out to the side or backwards. These disc herniations can be treated symptomatically. However, if we don't take the pressure off that compresses the vertebrae together, then we're not dealing with the cause of the problem. We're very effective in treating disc herniations. The pelvis is the foundation of the myofascial release approach. So let me show you what we think of when we evaluate and treat the pelvis. It's vital to the body to have a balanced pelvis. Pelvis means bowl in Latin. And as you can see, it forms like a bowl with two halves coming together. Each of these halves is called an ilium. These two portions here, which are the hips on our body, should be level. There's various other landmarks that we check in evaluation and treatment of the pelvis to ensure that this structure is level. However, sometimes with many people it's not, and one side could be higher than the other, such as this. If the right side is higher than the left side, what this does is creates a rotation to the lumbar spine. Because our body abhors walking around at an angle, then there forms a scoliosis as the body turns back in space in order to right itself. This also shortens one leg. Therefore, every time we stand or walk, we have abnormal force distribution through the pelvis into the spine, our shock absorbers, and we get things like disc herniations, hip problems, back problems, runner's knee or knee problems, etc., etc. The list goes on. It's very important that we level the pelvis, which is usually done the first few treatment sessions utilizing myofascial release principles, where we use the osseous structures, the bones, as handles in order to create correction and alignment in very gentle ways. There's also the tailbone or the coccyx. This should be a nice smooth alignment along with the sacrum. However, often as a result of repeated falls as a child onto the tailbone, or surgeries within the pelvic floor, such as C-sections, hysterectomies, etc., that tailbone is pulled forwards in space and is not continuous with the sacrum, but is rather in a horizontal position. That creates a very abnormal tension environment in the pelvic floor, squeezing down on vital structures like the bladder, causing urinary frequency or exacerbating the already uncomfortable sensations of PMS. So as you can see, myofascial release is not diagnosis specific. Most people can benefit from this very special form of body work. By restoring equilibrium and balance to your body's structure, alignment, and energy system, it alleviates symptoms. Myofascial release is not used on its own. It's very effective when used in combination with other alternative therapies such as acupuncture and nutrition, which we have in our office, as well as the traditional forms of therapy such as physical therapy and modalities, etc. Therapeutic exercise is vital. In fact, there's some very effective videos of self-treatment technique samples that we might teach our patients as part of a comprehensive program. So we look forward to hearing from you. If you feel, after listening to this, that this form of therapy can help you, it would be our honor. Give us a call.